Hello everybody, my name is Katina Tzanetos and I'm here to talk to you today about how to write an effective multiple choice question. My interest and experience in this area stems from my position as chair of the Medical Council of Canada's Medicine Test Committee. We're the committee that writes multiple choice questions for the domains of family medicine, internal medicine, and emergency medicine for the Part 1 exam, which is the exam that students write at the end of medical school. Because of this, the strategies I'm going to present to you are based on those that we use at the Medical Council. Having seen exams from other licensing bodies such as the Royal College and the MBME, I can tell you that they follow a very similar format. I have no conflicts of interest to declare. Earlier versions of this talk are partially based upon one that was presented by Dr. Claire Tucci, who's the Vice Chair of Education at the Medical Council, and I've included that as a reference for you at the end. Multiple choice questions are also based on ones that we use within our own pre-clerkship, and I've incorporated these as examples throughout for our learning. Finally, I've taken some of the examples from the Medical Council and the Royal College guidelines, and I've referenced these at the end for you. By the end of this module and over the next 20 minutes or so, I hope that you will be able to identify content worthy of being tested by multiple choice questions, i.e., where do you want to focus your energy? That you'll be able to define the anatomy of a well-written MCQ and know the steps to writing a well-written MCQ, and I'm going to provide you with some guides. And that you'll be able to define and identify what we call technical flaws, so you can avoid writing these into your question. A preliminary step in writing an effective multiple choice question is defining exactly what it is you want to ask about. You want to first, of course, choose the illness or the presentation that's of interest, but you don't want to stop there. You actually want to ask yourself, what is it specifically about this illness that I want to test? Remember, as much as possible, not to write questions that are purely of a factual nature. We're not trying to test a student's ability to memorize. We want to know if they can actually take the knowledge they have and apply it at the bedside. And so it's best to write questions that focus on things like history taking, physical examination, diagnosis, or management. When you're writing a question, you want to think about what are the common illnesses that we want all students to know about, for example, chest pain or myocardial infarction. You may want to write some questions about less common or rare illnesses, but ones that are critically important. For example, aortic dissection is not as common as myocardial infarction, but we don't want any of our students missing an aortic dissection. So a question around that illness would be worthy. Finally, you may want to also ask yourself, what are the areas of challenge to the weak student? Where do my weak students go wrong? Where my strong students go right? These are the questions that tend to be the most discriminating. Here's an example of a question. The topic is bacterial meningitis, and the context is the treatment of bacterial meningitis. You want to, though, hone in on what's the testable point, and in this instance, it's recognizing the need for urgent initiation of antibiotics. Have a look at this question. And here are the distractors, and the correct answer is obviously B, which is initiation of intravenous antibiotics. And this is an area where the strong students go right. They know that you need to start IV antibiotics quickly, but the weaker student may not. They may think that A, transfer for CT, or C, lumbar puncture is the correct answer. When you're writing your MCQ, you want to hone in on what it is specifically you want to test, and you want to avoid the temptation to do too much with one MCQ. One MCQ really should only test one specific topic or one specific part of an illness or presentation. Here's an example of a question that I think is trying to do too much. Have a look at this question. The answer, I think, is B, and I suspect that the author was trying to test whether the student knows that vascular risk factors can cause dementia. But as you'll see in a little bit, it doesn't follow the format that we would suggest for a multiple choice question, and it's trying to do too much. Is it trying to know that the student knows that B is correct, or is it trying to know that the student knows that A, C, D, and E are incorrect? As I mentioned before, you want to write questions that are really not of a recall basis, but are focused more on clinical application of knowledge. And it's actually not that difficult to write a question that's more application of knowledge, or to tweak a question to make sure that we're tapping into clinical application. Have a look at this question, and it focuses on looking at whether the student understands that prednisone can cause diabetes. This way this question is written is more of a factual recall type of question, but with a slight change to the question, it becomes one that's more of an application question. We're going to go on now and talk about the anatomy of an MCQ. Every MCQ should have 3 parts. There's a STEM, which is a clinical vignette that's presented to the student, the lead-in question, which is the task that we ask the student to perform, and the options. And within the options are contained 1 single correct response and 3 to 4 distractors. The shape of the MCQ is also important. The STEM should always be longer than the distractors. Let's talk about writing the STEM a bit more deeply. You want to always choose a clinical vignette that's based on a real patient. This is going to allow you to make sure you're not asking questions that are of a trivial nature. You want to include only relevant information in the STEM that's pertinent to the task at hand. And usually this means including the age, the setting, and the presenting problem. And you want to avoid the temptation to make your question more difficult by omitting important pieces of information or including red herring data. Later on in the presentation, I'm going to show you an alternate strategy for increasing the difficulty of your question, but writing tricky items is not really a good strategy. Have a look at this MCQ. What do you think the correct answer might be? It's impossible to tell. There's really not enough contained in the STEM to distinguish between all of the different options. All of these could present with left-sided chest pain and shortness of breath. Next, we're going to talk a little bit more deeply about writing the lead-in. The lead-in question or the task should always be very clearly worded. You should try asking questions that focus on clinical decision-making, such as history, physical, diagnosis, and management. This is going to ensure that your question is more of a clinical applicability type of question than a pure recall type of question. Which one of the following is often an excellent way to start your question? And you could ask, which one of the following is the next best step? Which one of the following physical exam findings is the most useful in establishing the diagnosis? Which one of the following is the most likely diagnosis? Or which one of the following is the most appropriate investigation or management at this time? At the Medical Council, we always talk about woofing a question, and the one that we prefer for questions that ask about investigations or management is which one of the following is the best next step. You want to perform the cover test of your question. That is, the question should be answerable without looking at the options. And so questions in the form of which one of the following regarding disease X is true tend to not work well, and I would avoid those. You also want to consider asking the student to perform a 2-step task. For example, you could ask about a management, but require that the student identify the diagnosis in order for them to be able to answer the question about management. And finally, I want to emphasize to you that you should avoid writing except questions. And synonyms for this are questions that ask things like which one of the following should you avoid, which one of the following is least likely, which of the following is contraindicated. Except questions don't perform well. They tend to stump the student who has the knowledge, and students who don't have the knowledge may answer them correctly. They're simply just too confusing. And at the Medical Council, we frequently review our bank, and we actually get rid of any question that's in the form of an except question. Step 3 is writing the correct answer and the distractors. And any MCQ should have only one correct answer with 3 to 4 distractors. Every course is a little bit different, and you'll be guided as to whether or not you should include 3 or 4 distractors. You want to avoid overlapping options or words such as all of the above or none of the above. It's just too confusing. You want to avoid the words all, always, never, completely, or absolutely in your distractors. Medicine is never absolute, and students won't choose those as options. And similarly, you want to avoid words like sometimes, frequently, often. They're just too vague, and that's a tip-off for students that they shouldn't choose that as an option. The correct answer should be clearly correct. Occasionally, you'll be looking for the best answer or the next step, and if that's what you're seeking, you should clearly indicate that in the lead-in. Distractors should be plausible options. They should be options that some students would consider choosing, and I often find it useful to think about my weaker students and ask myself, how would they answer the question? And these usually form the basis for good distractors. Next, we're going to move on and talk about technical flaws. A technical flaw is a problem with the way the question is written that allows the test-wise candidate to choose the correct option without necessarily knowing the content. And you want to avoid these, obviously, in your MCQs. To avoid technical flaws, all options should be of similar length. We tend to make the correct answer the longest option, and that's a tip-off to students. As well, all options should be grammatically correct. We tend to focus our energy mostly on the correct option, and while that one may be grammatically correct, we often make grammatical errors in the distractors, and test-wise students will know this. This is an example of a technical flaw that's called convergence. Have a look at this MCQ. You'll see that the words shortened, abducted, and externally rotated appear most often, and this is a logical cue to students that D is the correct answer. A better way to have written this question would have been to describe the patient findings in the stem and ask what the diagnosis might be. Next, we'll talk about a technical flaw that we call word repeats. Have a look at this MCQ. You'll notice that words similar to C, absence of pallor and sweating, appear directly in the stem, i.e. she is not pale and she is not diaphoretic. And this is a tip-off to students that C is the correct answer. This question is also an example of what I call window dressing. You'll notice that the clinical vignette is actually not necessary to answer the question. The question could start at which one of the following is the most typical of a convergence symptom rather than a syncopal episode due to orthostatic hypotension. And so the clinical vignette is really not needed. And you want to write a clinical vignette that's necessary for the student to understand and appreciate in order for them to get to the correct answer. Earlier, we talked about making sure that we're not creating tricky items by including irrelevant data or omitting relevant data. And I'm going to show you a strategy for actually changing the difficulty level of a question that works in a much better fashion. Have a look at this question. This question would be geared towards the medical student level, and it's a well-written question. Here's a slight variation of the question where simply the distractors have been changed. And by doing this, the question suddenly becomes more challenging. And now the question is at the resident level. This is a good strategy for making your question more difficult. Change the distractors. Finally, I want to talk to you about how you can make the best use of your time, how you can write the largest number of MCQs in the shortest period of time. And you can use the strategy that we call cloning. This is where you use the same stem, but you change the lead-in and the distractors to create multiple questions. Have a look at this stem. Related to the stem, you could ask which one of the following is the most likely diagnosis, or which one of the following tests would help to establish a diagnosis. In fact, you could probably go on to ask more questions about management, etc. And so you're using the same clinical vignette and stem to ask multiple questions. When you're using the strategy, you have to remember to label these questions as what we call bad neighbors so that they don't appear on the same exam. I hope you found this presentation useful. Remember that writing your MCQ is really the first step. It usually needs to go through multiple revisions for you to come up with a product that you're truly happy with. Thanks for your time.